welcome to today's Insta Live, and today I'm going to talk with Dr. Laura from Clínica Tambre in Madrid, and we're going to talk about a very important topic. I know you're all excited to hear about it, and it's about fertility treatment during uncertain times. This is so important, especially since we have a pandemic and it's really hard to have fertility treatment, and you might be concerned about all the things that during these uncertain times. So we have Dr. Laura with us today, and she's going to tell us everything that you need to know about having treatment during uncertain times. Hello, Dr. Laura.
Hello, how are you?
I'm okay. How are you?
Very well. Can you see me and hear me?
I can see pink on my screen. I can't see you yet.
Sorry. Yeah, right now.
Perfect. Welcome.
Okay.
Thank you so much for taking the time to join us from Clínica Tambre in Madrid, right?
Yes, thank you, Andrea, for giving us this opportunity.
And we're going to talk about fertility treatment during uncertain times, which is such an important topic because we've been having unprecedented difficult times since March or April, and it has been really difficult in Spain and here in the UK as well, and it makes it so hard for patients to go and have the treatment that they want to have. But I also know that
Correct.
we've learned so much over this last 6 or 7 months, and clinics have adjusted. So I want to know, how can patients have treatment with you? What does it look like? If we start from maybe the beginning, that initial approach, the initial consultation.
Yeah, of course, everybody's concerned about this situation, but when they just have the first contact with one of our coordinators and just explain all the new, protocol that we have for COVID situation, the new, installations as ours terrace that has been converted into waiting room, and all our process such as COVID-19 testing for everybody before entering the clinic, and of course gloves and masks provided to all patients when entering. They feel that we are a COVID-free clinic and they are safe. So of course it's the first point that we need to clear, that it's not a big issue, COVID, for fertility. It's not a problem for pregnancy. It is more or less as a flu, and the only part it's in the end of the pregnancy. We really need to take care and try to maximize all the protocol to avoid contact with people and all this, because it's in the last part of the pregnancy where we can have a little bit of more problems with COVID.
So when patients need to book a face-to-face consultation, they can just book it, and there will be social distancing in the clinic. Potentially everyone is wearing face masks as well.
Of course, all doctors, we are in our individual consulting room with windows opens, with our great masks, and of course they will be waiting in individual waiting rooms or in the terrace, so we can just control that everything is going to be all right and we're not going to transmit COVID in our installations.
And if a patient wants to schedule a consultation, for example, remotely via Skype, is that possible as well, to minimize, have less
Of
trips
course.
to Madrid?
Of course, before COVID, we used to have a lot of Skype consultations with people living abroad. And right now, of course, with this, pandemic situation, Skypes and telephone consultations are getting more and more common. And this is ideal because, I can ask them to do a scan with our collaborators in 104 Holly Street, led by Dr. Bill Smith. and I can ask them to do a blood test if necessary. With other partners, we have Fertility Health. That's a very good company that enables patients to do blood tests at their home. So of course they can do all the process when they are in the UK and only come for the embryo transfer. So this is very reassuring for them that it's safe, and we can plan everything and not necessary to come many times.
Yeah. So that sounds like a good strategy. You're doing these online consultations, and then when you go there, there's already measures in place to make the treatment as safe as possible. And in terms of restrictions in Spain, do patients need to do a COVID test, or do they need to quarantine when they travel to Spain?
Not right now. We don't know what's going to happen, but right now it's not necessary. But regarding the fertility treatment and the risk for COVID, it is recommended due to our fertility society to have a COVID test before the embryo transfer, before the sperm collection, before the egg retrieval.
Okay, and that will be done there at the clinic as well.
Yeah, they can choose to do it here in the clinic or to do it before they are flying to Madrid.
Okay, and that is just to minimize having someone who is pregnant who has COVID, or there isn't a big risk for pregnant people if they get COVID, isn't it? But it's just to minimize transmitting that to other people.
But Andrea, the data is limited, so we don't really know what potentially could happen. So of course, if we have this, good test, why not to do it? And if there is a COVID, situation positive in any patient, it's better to postpone the treatment when we are not at risk. And also, we prevent other patients in the clinic to get exposed to COVID, patients. So it's for both situations, for their healthy pregnancy, and also because we want to minimize the possibility of transmitting to other patients.
And I know there has been a lot of restrictions in maternity services, not allowing the male partner to be with women in the delivery suits. But does that happen in the clinic, or are husbands and male partners allowed to go to the fertility consultations and to embryo transfers and the treatment in general? I think we've lost Dr. Laura.
Sorry?
I was asking if male partners are allowed to be there with their spouses for treatment, because I know there's a lot of restrictions at the moment here in UK, not allowing partners to go into hospital or into clinics with...
Yeah. If they can show that they have a COVID negative, they can enter the clinic. But by contrast, we ask to all our patients that it's better to go to the, embryo transfer room, just the doctor and, the patient herself, the woman, to minimize risk with embryos. And everybody really understands this situation and helps to, really do this protocol.
Yes, and if we look at the data, is there any specific risk for patients? Should they be afraid of getting pregnant during coronavirus, or is it relatively safe being pregnant?
The literature reports that there are no important risks and compares COVID a little bit with other virus that we used to have in the past. For the pregnant, it's more or less, as I said, a flu, but by contrast, there is a little bit more risk in the third trimester to have any other symptoms more severe, such as pneumonia, okay, that could need to be in the hospital. For the baby, general literature, the big part of the literature is reporting that the risk is extremely low. Of course, there are some evidence that are reporting adverse events, such as, more events of premature live births, but it's not 100% confirmed. And the point is that we do not know when this COVID pandemic is going to end. Yes. And there are a lot of women that really desire to have a baby right now, or even they have, long time of infertility. They are at, a point of their lives that they cannot wait more to have a baby because of their age. So it's going to be more, challenging if we wait some years. So all literature is reporting that it's not necessary to prevent the pregnancy when natural report at home. So the same for fertility treatments. So the important is to do, the treatment in a professional clinic with all the protocols, prevent, to transfer or do whatever during a positive coronavirus situation. And for the rest, it's just to really take care of ourselves, of our family, as we need to do, no matter if we are pregnant or not.
Yes. And have you noticed if patients are maybe more anxious or stressed about the whole process during these last few months of uncertainty?
I noticed in the beginning when we started with all this in March, it was crazy and everybody was, having like panic and stress. I think right now we're all, understanding that we need to cope with the situation, and we are just, going ahead and living our lives and continue, with, of course, the risks, but, just continuing our projects.
And Dr. Laura, maybe you can tell us a bit about the clinic and the type of treatments that you provide, because maybe some of the people who are going to watch this video on IGTV, they don't know the clinic and maybe they are looking for fertility treatment. What kind of treatments do you offer?
We offer all type of treatments in our clinic. Of course, fertility freezing for women that don't want to, have maternity right now, so egg freezing. We also offer IVF with, own partner or with a donor, and also IUI, egg donation, embryo adoption, so all type of fertility treatment that you need to do it.
Brilliant. I think Madrid is a beautiful city. I remember being in Madrid when I was a teenager, going to a concert. What kind of sightseeing can patients do? Because I imagine that when patients go and have treatment abroad, it's almost like a mini holiday. You're having treatment, but you have this opportunity to disconnect from work, disconnect from family and house duties, and just be in that well-being state where you're trying to get pregnant, but you're also looking after your well-being and seeing a bit of the new environment.
Yeah, of course, our clinic is in a very nice neighborhood, very calm, very relaxing, but it's not far away from the center. So, Madrid has very nice places to visit, the downtown, museums, but also there are very nice traditional cities next to Madrid, such as Toledo, Segovia. So it's very common to receive patients that they are very happy to visit not only Madrid, but also these nice cities that are close to Madrid. So they get enjoyed of our, food, of our culture. So usually they are very, very happy to have chosen Clínica Tambre for the fertility treatment, but also to visit Madrid and this nice city with nice weather and very good people.
And I think one of the biggest advantages is that the flights from London or from any other capital in Europe, they are relatively easy and low cost to Madrid as well. So it makes it easy to travel to Madrid as well.
Correct. We do often fly to London, to visit some partners or even talk with some patients. And of course, it is, very interesting to book different companies and different timetables. So it's, around 2 hours and a half, and then, connections with airports are extremely, extremely good. And also we have the possibility to just pick up our patients with our own private taxi from the clinic. So it's very, very nice to patients, choose a clinic that has these facilities.
It's like a VIP treatment.
Correct, yeah. I mean, it's really stressing, so we really need to make everything easy and, the most comfortable for them. Also, if necessary, because usually right now we are, organizing one day visiting the clinic or one day full treatment. But if they need to have a night in Madrid, we also help with our hotels that are working with us with special fees and close to the clinic. So that makes them feel more comfortable that we help with all this.
Yeah, so it makes it super easy, and it's good that we're passing the idea that it's super stressful for people who are already feeling very stressed with fertility treatment at the moment, but it's still possible to have treatment and to have it in a safe environment that is safe for you and is safe for your baby.
Correct. I have lots of UK patients that they come here and they just report they had like 2 or 3 failures in other clinics in the UK, and just coming in the first consultation or starting their treatment, they are extremely pleased to have chosen the clinic because they feel the atmosphere, that everything is relaxed and everything it's very individual. So of course we want to achieve the pregnancy the sooner the possible, but they understand our objectives and our way of working at the very beginning of their treatment. So they are very happy and very pleased to us from the beginning.
Dr. Laura, one last question. If you could give maybe 2 or 3 pieces of advice to our patients who are feeling the uncertainty and the anxiety of having treatment right now, what would be your last pieces of advice to them?
My advice is that they really need to be optimistic, okay? So it's extremely rare not to be possible to achieve pregnancy with all the techniques and all the tests that we have right now. And they just need to select a good clinic with good laboratory, with good professionals. And of course, if they do all the steps that are necessary, all the tests that we do recommend, of course, our chances will be very high.
Brilliant. Dr. Laura, thank you so much for joining us.
Thanks a lot for your time.
To say that today starts a new campaign by the International Federation of Fertility Societies about giving hope to people who are having treatment during these uncertain times. So you might have seen that there is a certain image that is being shared today, and every Monday for the rest of the month until end of October, there will be a message of hope to these patients. And today's message is exactly to ask for help, to reach out to doctors, nurses, to those people who can help you during this time. So if you are in that circumstance, don't be afraid of having treatment during this time. Fertility treatment is already a very safe and protocolized approach. Everything happens within certain guidance and regulations. So now we just need to have a bit more work with transmitting of the coronavirus, but it's possible to have safe treatment. Dr. Laura, finally, how can patients find you? They can go on your Instagram of course, when you're
Correct.
clinical program.
Also via Facebook, via email, telephone. We have our own web, so we are ready to help them.
Brilliant. And if anyone has any questions, you can email me or email Dr. Laura on their Instagram, and let us know how you are coping during these times. Let us know in comments. This video will be on IGTV, and we are here to support you with everything that you need. Thank you, Dr. Laura.
Thank you. Bye bye, Andrea. Take care.